The exact moment a patient is discharged from the hospital, a 30-day clock starts ticking. That brief window determines whether they stay healthy at home or end up right back in the emergency room. This population diagram highlights the current failure rate. Nearly 1 in 5 Medicare beneficiaries is readmitted within this 30-day window. As the figures dissolve, the financial weight becomes clear. Unplanned hospital readmissions cost Medicare approximately $17.4 billion every year. The Centers for Medicare and Medicaid Services responded with a heavy regulatory backlash. They now penalize hospitals for excess readmissions, striking over 2,200 facilities in 2023 alone. When 1 in 5 patients bounces back to the hospital, it represents a highly expensive systemic failure occurring precisely at the point of care transition. At the private clinic level, managing that transition is rarely anyone's dedicated job. Instead, it usually falls onto an overworked front desk staffer who is simultaneously juggling a dozen other tasks. This line graph illustrates the core paradox of the situation. Highly effective transitional care management protocols exist, but the front office support staff meant to execute them face turnover rates as high as 40%. Medical group leaders consistently cite finding qualified candidates as their primary operational challenge, well ahead of limits on compensation or technology. This calendar grid shows exactly how that staffing shortage translates into clinical failure. When a clinic is short-staffed, the critical 2-business-day outreach window slips away, which is linked to a 44% no-show rate for follow-up appointments. Missing that strict outreach window carries a severe operational consequence. The practice permanently loses the ability to capture their earned Medicare transitional care management billing revenue. The transitional care crisis is ultimately a human bandwidth bottleneck. When administrative work is squeezed in, it produces squeezed-in medical results. Because internal staffing is often too unstable to manage these workflows, a growing number of practices are shifting to a dedicated offshore transitional care model. This is where Staffingly steps in, providing dedicated, healthcare-trained virtual medical assistants engineered specifically to handle transitional care workflows. The model utilizes trained professionals, including U.S. licensed registered nurses and doctors of pharmacy, to ensure clinical competency during patient outreach. This specialized task force operates entirely within the practice's existing electronic health record ecosystem, seamlessly integrating with over 50 major platforms. To ensure total patient security, the environment is fully HIPAA certified and SOC 2 Type 2 compliant, operating with zero local data storage. An AI automation layer continuously analyzes specialist workloads to support the human team. It smartly routes tasks to prevent operational backlogs before they form. This specialized approach replaces chaotic, improvised patient outreach with a highly trained, dedicated clinical task force. A dedicated coordinator initiates contact, securing the 2-business-day outreach milestone on the 30-day critical path timeline. They conduct medication reconciliation, 2 pill lists merging into one. They lock specialist appointments into the calendar. A real-time SLA monitor automatically flags deadlines, protecting the Medicare billing window. Behind the scenes, continuous trend analysis monitors specific patient populations, automatically refining the workflow to reduce future entry errors. This precise, relentless follow-up transforms the chaotic post-discharge period from a liability into a strictly controlled, trackable clinical pathway. The data shows that patients receiving the full complement of structured transitional care experience an 86.6% decrease in their odds of a 30-day hospital readmission. Patient behavior shifts under this supervision. Dedicated coordinators reduce appointment no-show rates from 44% down to 12 or 15%. This side-by-side chart outlines the economic reality of achieving these results. On the left, the towering bar shows the cost of an in-house hire, which reaches $70,000 annually when fully loaded with benefits and overhead. On the right, the Staffingly solution costs $21,600 a year. That is a 64% cost reduction, representing nearly $40,000 in annual savings per position. Practices can launch this system in 48 to 72 hours using a 30-day risk-free pilot with absolutely no long-term contracts. Outsourcing dedicated transitional care is a logical strategic move. It allows capturing lost revenue, stabilize clinic staffing, and close the transition gap permanently.